are ongoing on the review class, we will continue on 5 to 6 lectures every Sunday on at 10 to 11 a.m. Hopefully, in the meantime, we will complete all sorts of the psychic disorders in a concise way. As you are exposed in the psychiatry diagnosis disorders in the previous lectures and also in the word placement, so we will concise. And if any sorts of problem, you have some sorts of the raise questions regarding any clearance, and probably you have only the high time to raise question at the time of the blog posting. But at the time of the corona, you might have some sort of shortage in the blog posting. So this might be the last time to have an hope to reach on the sorts of psychic diagnosis. So introduce the psychiatry. We should know the psychiatry, then the psychology, the normal behavior, then the abnormal behavior, some sorts of the phenomenology, and phenomenology, and we will conclude these sessions today on the ground of the introduction and phenomenology. And to psychiatry, you know, the psych is the meaning of the mind, and like triggers means the healing. That the psychiatry is some source of the medical science that is deals with diagnosis treatment of the mental illness or psychological illness. And to know the psychiatry, psychology is an important topic, as like in the physiology before the pathology and the clinical medicine. The psychology is the scientific study which is depend on the behavior and mental process, mental behavior and mental process. And you know all sorts of the activities which can be we can record it, observe and measure. These the behaviors and mental process which are not directly observed, record or measured, but can be reflected through the behavior that like an emotion, mood, perceptions, memories, and motivations, and all sorts of the concise the psychology. So once have behaved the normal or abnormal behavior, you should know what is the normal behaviors and what is the abnormal behavior. Normal behavior is not an entity; it is then some sort of performance according to the social norms. Those are not again harmful to the self and environment. But if it is harmful to the self and environment, or again it is not again the perform not perform in social norms. This is in the abnormality. But in the ground of the psychiatric disorders, if this performance is not in accordance to social norms and behavior, but uh, that might not be harmful to the individuals and society. It is very much absurd. As if you someone else enter in the class at the end of the class, and he will have a good performance in the class or results, test results. This is not obvious at all. So there might be a link between the performance which are socially acceptable and not harmful to the individual and society. And abnormal behaviors are not the meeting social norms and causing harms to the individuals and society. And two terminologies are the psychosis and neurosis. If we want to psychiatry, is in minutes of time or in a fractions of time, if you know the psychosis and neurosis is enough. because if the psychosis patients or any person suffering from psychosis, they might not be good insight regarding their activity. That is, they are not aware about what are they doing is normal, is the deviation from the normality or not. And again, this is harmful to himself or society. So psychosis is an inability to distinguish between the reality and fantasy, and neurosis is the intact. Even then, the performance might not be impaired. So neurosis is far differ from the psychosis. If patients, any sorts of patients suffering from psychosis, he might not be intended to have some sort of consent for his treatment. But on the basis of the neurosis, is very much options for the treatment options that might be have some sort of list of treatment options, which treatment might be chosen by the client is depend on the client, not to the physician. So if have some sort of various options in treating the neurosis, and most of the patients are suffering from the neurosis, whereas we are considering the about the 16.06% of the Bangladesh people are suffering with psychiatric disorders. Among them, around to 15% are suffering from the neurosis, and only the 1% or less than 1% suffering from psychosis. So the psychotic patients might be treated with an mandatory way without any sort of consent. That might be consent from the authority or the family members, and on the grounds of the neurosis. This authentically, the conscience might be comes from the patient, not necessary for the caregivers. If not, he's the underage even then. And some sorts of the difference, whereas we want to psychosis in psychiatry and psychology. The psychological deals with the normal some states of mind, and we were aware as in psychiatry deals with the abnormal states of mind and behavior. And the psychology, to know the psychiatry, you know what is the normal phenomena, what is the normal type of the behavior, mental process. You should know. Then you can approach the what is the abnormality and what might be the treatment approach. So obviously, prior to the knowing the psychiatry, you should know the psychological measures. And some sorts of the relation between the psychiatry and medical illness is there, as the medical illness is all sorts of patients have come from some sort of sufferings that might be mimic some sorts of physical illness, medical illness, but even then the some sorts of physical illness might be present with the psychological measure, and some psychological measures might be present with the medical measures, medical symptoms. So psychological factors as the cause of some sort of physical illness, psychiatric consequence of the physical illness is there, and psychiatry and physical disorders or the medical disorders occurring can be occur together by chance, and the psychiatric problems presented with some sort of the physical complication. Even then, if these psychiatric problems runs long, and even some sorts of the consequence of the psychiatric problem, some sorts of physical illness there, as there's some sort of neglected or non-compliance of medications there, obviously in the psychiatric disorders. So there is some sort of the future in the psychiatry. Even then, in the time of the corona, we are obviously focusing on mental health. Mental health, as this is not an disorder of the mental disorder. Even then, the some sorts of the health, boost up immune, some sort of psychological measures. And again, if person is suffering from the corona, he might have some sort of burden with the anxiety and depression. Even if patients or the clients suffering from the anxiety in correlation with the corona, that have heightened the limits, and what should be doing and what should not be doing is impaired in this manner. Again, you have the patients of the corona suffering from the comorbidity, suffering from the or the reactive suffering from the depression.
he might have some loss of interest in doing some sorts of the precautions to having some security measures, to having gargling or taking food or taking air, having some sorts of brief exercise that have and some sort of lessen the immune system, and disease the viral loads might be increased, then the ARDS like symptoms might be developed. So the healing process might be happen some sort of role in regards to this psychological problem. So these sorts of psychiatric symptoms might present in the several ways that might be present in the mental symptoms, might be physical symptoms, and some sorts of biological symptoms. But obviously, some sorts of biological symptoms are correlate with some sort of organic basis. Organic basis. The mental symptoms comes to if we go through some sort of mental state examinations, we go through the disorders. If some sorts of we focus on the appearance and behavior, some sorts of neglect, self-neglect is there. Some sorts of the blunted in effect, he might not be respond at all in properly, and moving without any sorts of stress that might happen some sort of features to present the you to come on, and some sorts of collecting or eating food from the dustbin. Obviously, even then, the some sorts of the professions develop as an occupied. They are having some or the Hungary. They are used to have their professions to continue their family life. But even then, without sorts of the any sorts of the aimlessly, they are collecting or the eating the food dustbin. This again some sort of reflects the psychiatric disorders. And picking dirty paper and other objects and overall some sorts of familial, over familial, if any sorts of persons are behaving as over familiar, that might be a mimic some sorts of disorders like the mania. You all know. If any sorts of problem, you haven't raise your hands to may be clear in the later on. And other mental symptoms like the if the some sort present with the speech where this is the if patients or clients talk excessively, that happen some mimic and again the bipolar one, bipolar disorders and poverty of speech. Again, having some chronic patients or the chronic schizophrenia or the major depressive disorder may present with the poverty. That might be in the quality and quantity and some sort of reduce the volume. And these patients or clients speak irrelevantly, that is determinlessly. If patients or clients talk, that is the reflection of some sort of schizophrenia, like an that is different type of schizophrenia. And even then, patients not talk at all. That happens several diseases that might be organic, that might be inorganic, that might be organic, like dementia or delirium or delirium on dementia, or any sorts of the that is dyslipidemia lead to a mute state. But and in the psychiatric ground, if patient is suffering from the schizophrenia, even if suffering from the chronic schizophrenia or the type of schizophrenia or the major depressive disorder may present with the mute. Even then, and in some sorts of the controversial disorders also present with the mute. So presentation might be very in various symptoms. And like the mood disorder, on the presence of the mood, patient may present mood symptoms like the mood may be some sort of swing the mood, some sort of elevation of the mood, some sort of depression of the mood, and some anxiety and labile. Labile is mostly represent bipolar. Again, the elevator is in bipolar and depressed. That might be bipolar in the phase of the depression or the major depression. The anxiety follow is some sort in any case, the person might be anxious. And irritable means mood, is obviously the depression features of depression, especially in the case of the elder, that is the adolescence or the childhood period. Only the mood might be diagnosed with the major depression in the adolescence and childhood. In the regard to the thought process, the thought is not the part at all. The thought is the mental process, but it might be reflect for some sorts of the sorts of behaviors like the writings or like the speech. So the thought might be flight to another. There is fight about it, and this will be the one and the less loosening of essence, the looseness of the essence. Yes, 11 of speech reflect is the behavior which is reflect from the loosening of essence, the thought process. Loosening of essence, the thought process, and that is reflected to the some sort of behavior tells the 11 speech. So some sort of connection from the mental process and the behavior. So we previously said that the some sort of mental process is not um, um, directly observed, recorded, or the means, but it reflects from some sort of the behavior. So this is the thought process. So looseness of the association reflects some sort in the 11 of the speech, and these are very mimically significant for the dinosaurs. And the subsurface steam gets how the uh, species flows or is the pressure. Pressure is not there more pressure. Some persons are talking very fastly. That means he some sort of the thoughts comes his mind very rapidly. So this reflects or the some sort of behavior. The pressure of thought might be the reflection reflected as in some sort of increased talk and poverty of thought. Again, the some sort of the reduce speech and a thought block. This is very much important. This is very much significant in regard to the diagnosis of schizophrenia. Yes, we are frequently observed in the exam hall. This is extreme anxiety that might be thought block, but in the real sense, if the thought block is there, some sort of abrupt and a complete interruption in the flow of the conversation repeatedly, and he or she might not again memorize the thought process, what the previous thought is there is exactly the thought block. But in the sense of the head anxiety, that might have some source of the information as there I might uh, memorize some source of the topic, but in this process I cannot. That is the difference in the thought block in the depression, the anxiety, heightened anxiety, and the schizophrenia. And the result of content of thought, there's some sort of very much important is the delusions. There are some sort of obsessive overwhelming ideas and suicidal often said thoughts. There is the content. What the behavior or what you talk about the what is the summary is the some sort of the thought content of the thought. So on the content of thought, the delusion is important in this sense because on the basis of delusion, if we want to diagnose the case of the schizophrenia, there is then five entities: the delusion, hallucination, speech, remember negative symptoms. If some sort of the two features might be present, one must be delusion or hallucinations or dissonant speech. So if the patient, even then, only single entity is there, the delusions of the visual delusion is there, it is enough diagnosis case of schizophrenia. So delusion is very much important. And in the exam, you are asked some sort of question regarding the cycle table, table where the cycle is state, the delusion is included. But this is important and little bit complicated. So you should not only key points. The delusion is in belief. It is an act in belief, not in it is not the perception. In the in regard to the perception, that might be the hallucination. In the regard to the belief, that is the delusion. But this belief is different in some sorts of from the overvalue ideas because delusion is an firm belief and is in the grounds and is not affected by the some sort of the rational arguments or some sort of evidence. And it's not a conventional belief that the person might expected to hold even his or her education business background. On the grounds of this, that is the in the grounds of the this that is the on grounds of the these is different from the our ideas and the delusions on the ground of the this. That is if there is some uh, delusions there firm belief and some sorts of is not in ground of the energetic grounds and not the affected by rational argument. This is the delusion. But if there is some sort of background of the in the social cultural educational background, there is some sort of behavior, there is a belief that is not an delusion. That might be overvalued ideas. So this is the delusion. So delusion is very much important in regard to your any sorts of the facing any sort of psychiatrist. So again, important in the diagnosis. That is the only the delusion that is visual delusion is enough to diagnose in case of different event and delusion have some various types. That is the persecutory, grandiose, delusion, delusion reference. This persecutory is important in regard to the diagnosis of the schizophrenia. Again, any sorts of person might be having some persecutory, not a delusion. That is basically ideas. Ideas. That is the overall as like an overall idea. Some sorts of persecutory ideas there. And difference the idea and the delusion is there. If some sorts of the evidence there, if patients confirm or the his confusion is clear by some sort of arguing, this is the ideas. And if even then some sorts of evidence there, some sorts of the explanations there, even he might not be change his thoughts of the paranoia, is then paranoid delusion. And again, even the grandiose delusions, then the delusion reference very much frequent in any sorts of diagnosis is not very much important in diagnosis of schizophrenia at all. There is some guilt, and it might be in the depression. Again, the schizophrenia, nihilistic delusions, hypochondriac delusion, delusions religious, delusions jealous, sexual amorous, delusions control, and delusion concerning person thought. With the delusion concerning person is very important to diagnose the schizophrenia, but it should be confirmed by some sorts of the experienced person, experienced person. But in case of the some sort of the persecuted delusion, grandiose delusion is very much easy. Is very much easy to confirm. That might be different from the overall ideas. That is the perceived ideas or perceived delusion. This is the delusion of grandiose delusion or grandiose ideas. This might be difference with some sorts of questions. Where you have an idea or you have a strong belief. This is the difference. What the difference between the persecutory delusions and persecutory ideas and the religious and religious ideas. But in the case of the delusions of concerning position thoughts, the delusion thought insertion thought practice what we do. This is not very diagnostic in case of schizophrenia, but it should be confirmed by some sort of experts. And the most important delusions, the perceived delusions, the patient is convinced that the some persons or organizations are trying to inflict her or him, damage his reputation, make him insane or attempt was on him. This is an idea. This is an idea. If this is an idea, this is an perceived ideas. And if this is a strong belief, this is an perceived delusion. Again, the subset grandiose delusion is the belief of the exaggerated self-importance. Um, one may consider himself unusually healthy, wealthy, or some sort of possessor special power in any special situation. This is in some sorts of the dentistry. This is important in regard to the mood disorders and the obsessions. That is, obsessions is very much important in regard to the corona. We might be obsessed in the every sense. We might be obsessed in corporation to the obsessions. This is the obsession is the thought, and in the some sort of behavior is the compulsion. If some sort of obsession and compulsion might be there to cleaning or checking or ensuring. This is very much important in regard to the prevention of the corona. But afterward, the breakout of the corona, it might be OCD might be presentation in exaggerated way. So that might be alarming in the post COVID period. But the obsession is the can be defined as the recurrent and persistent thought, impulse, or image that enters the mind. Even then, some sources the echo to this source of the thought, impulse, or image, and some sort of perception. In regard to the perception, this is a process of becoming aware of what is present through the sense organ. That is, if some sort of stimuli is there, if you perceive, this is then some sort of perception. Without any sort of stimuli, if you perceive, that might be hallucination. As some sort of stimuli is there, even then you perceive in an distorted way, that is the illusion. So, if some sort of presentation is there, stimuli is there, and you perceive properly, this is the normal perception. If you perceive in a distorted way, this is the illusion. You perceive, even then, any source of stimuli is not there, there is then hallucination. So, in illusion might be present in case of the heightened anxiety and some sorts of the preoccupied emotions. That is an illusion. So, in this state, illusion might be there, and the hallucinations. No person in the in any illusions, the normal person might be there, and hallucinations. Regarding hallucinations, there are several forms. We have five senses. The five senses, parts of the five senses form the hallucinations. But in regard to the psychiatric diagnosis, very important then what is your hallucination? And in if there is some sort of olfactory orgasm that might have some sort of organic, and again some sort of visual hallucination. Also, in special cases, some special cases, except some special cases, the that is the visual hallucination might be again present and mimic the organic text. So any source of the if any source of the confusion, you can have some question. Any questions regarding the organic and functional hallucinations? Any question? Hello? Hello?
জি স্যার শোনা
জি
যাচ্ছে।
স্যার শোনা যাচ্ছে।
Can you hear?
Yes,
Yes, sir.
sir.
Can you hear me?
জি স্যার শোনা যাচ্ছে।
Hello? Can you hear me?
Yes,
হ্যালো
sir.
স্যার।
So some sorts of hallucinations or hallucinations, this is auditory hallucinations is very much obvious in the diagnosis of the schizophrenia. But other than the auditory hallucination, there is olfactory and gustatory and some sort of somatic is very much organic. In the somatic is the egg bomb hallucination. Is in some organic substance and some sorts of the tumor in the orbital gyrus may lead to the olfactory or gustatory hallucination. And visual hallucinations mostly in the visual tract. If there is any sort of pathology in the visual tract, that may present. Even then, any sort of the infarct in the occipital area, that may present with then some sort of olfactory visual hallucination. Other than visual hallucination, the auditory hallucination is very much significant in diagnosis of schizophrenia. So, in perspective of psychiatry, this is the hallucination. That is the hallucinations. Auditory hallucinations is some sort of form. The auditory and have and some sort of second person, third person. Even we have a question about the some sort of first person hallucination. In the second person hallucination, when the voice are heard clearly or indistinctly as a word or phrases or sentences addressing the patient directly, you or you. This is an second person reason. And in third person, when the voices are heard clearly or indistinctly, or talking one another, referring the patient as him or her, or he or she. This is in third person ordination. And the first person, if patients heard some sorts of voice which is regard to himself, this is in first person ordination. So second person is very much frequent, very much frequent in case of the bipolar, and again some sort of schizoaffective disorder, and in the third person ordination is obviously in the case of the schizophrenia. And first person, again, is significance to diagnose the schizophrenia. And some physical symptoms might present. Those are the presentation regarding the mental symptoms. In the psychiatric diagnosis might be present as in physical symptoms like pain, that is exacerbated and medically unexplained physical symptoms like the pain, numbness, burning sensation, paralysis, convulsion, different in the respiration, etc. Because some sort of physical symptoms is acceptable by the society, but all sorts of the mental symptoms like in any sort of the hallucinations, delusions, or the mood symptoms is not regarded by the society. So patient used to have some sort of the seeking behavior, attention seeking behavior is very much effective through the physical symptom, presenting the physical symptom. So he or she might be suffering from the psychological symptoms, but it is not accepted by the society. So he or she might present for some social symptoms which are acceptable by society. These are the physical symptoms. So any sort of the depression, anxiety, leads some sort of the pain, some sort of numbness. Even you are very much experienced, and or in regard to the diagnosis of the conversion disorder. In the case of conversion disorder, some sort of the abnormal presentation is there, but it is not correlate with some sort of physical illness. So it is occurred due to some sort of social acceptance. So pain, numbness, burning sensation, paralysis, convulsion or pseudo convulsions, and the problem in the respirations might be present as an psychological sufferings. So this is the problems uh, in regard to the presentations, and some sort of biological symptoms there. This is important. This is the sleep disturbance, any source of disease. Regardless of the psychiatry or the medical illness, there is a problem in the sleep disturbance. But this is very much significant in diagnosis of this psychiatric problems. If patient is suffering from the sleep disturbance in the type of the working type of the sleep disturbance, that is very much important, or that is very much related with the diagnosis of the major depressive disorder. Again, if there is problem in the initiation sleep, that is very much important to diagnose the anxiety disorders. If there is a reduced need of sleep, what may be the diagnosis? What may be the clinical correlation? Can you hear me? Hello?
Yes, sir.
Can you hear me, please?
Yes, sir.
Patient diarrhea হতো lack of interest to the features of depression. Amenorrhea, other menstrual problems. Amenorrhea শুধু না, রিলেটিভ অ্যামেনোরিয়া। অ্যামেনোরিয়া বলতে কিন্তু এখানে অ্যামেনোরিয়া, টোটাল অ্যামেনোরিয়া হয়তো রিলেটিভ অ্যামেনোরিয়াটা খুব বেশি প্রেজেন্ট হয়। রিলেটিভ অ্যামেনোরিয়া মানে কি? If some sorts of features, if some ladies are suffering experience with the 5 or 7 days of the menstrual cycle, menstrual period, it is left in the only the last only the 1 days or even the half days. There is again that is the relative amenorrhea. in terms of the psychiatric ground. This is again the features that might be features of the psychological problems. And again, happens also the if the period is the heightened, even then the cycle would be the whiten. That might be features of the psychological ground. So these are the biological symptoms. Again, the some sexual problems, if the lack of libido or lack of interest or some sorts of the lack of arousal, this is again the biological symptoms. So this is very much significant to diagnose and the psychiatric grounds. So in the this way, if we concise or summarize the today's sessions, we want to have some sort of the normal behavior, difference with the abnormal behavior. The normal behavior is the some sort of the behaviors that is acceptable by the social norms and environment and is not harmful to self and the other societies. This is the normal behavior. And again, if the normal behavior persists some sort of the functional impairment, is done psychological disorders, any sort of psychiatric disorders. And the ground with the psychiatry and psychology, it is the some sort of the behavior mental process in the normal way. This is the psychology. It is an abnormal way, and in addition to some sort of the diagnosis, treatment, or prevention, this is the entity of the psychiatry. And some sorts of phenomenology is there. One is the psychosis and neurosis. That is the psychosis, the impaired insight. The insight is the some sorts of reality testing. That is the he or she might be aware about the self and environment. This is the insight. If there is an impaired insight, this is a psychosis. If they said this is an intact insight, even there some sort of impairment in the functional ground, that might be suffering from the neurosis. In a psychosis, the treatment is mandatory. There is no need for consent from the patient. In the other ground, if the patient is suffering from the neurosis, he might have several options there. Even then, patient might pick up some sorts of options. So, in regard to his choice, his or her choice, on the ground of the phenomenology, that is the very much important in regard to the MSc, that is the appearance in the person may present with the mental symptoms, might be present in the physical symptoms, might be present in the biological symptoms. Mental symptoms are in accordance to the MSc. The MSc, that is the appearance in the person might be neglected. Now, in ground of the mood, in ground of the speech, in ground of the perceptions, in ground of the speech, in ground of the content of the thought, that might be changed. That is the delusions. That is most important in the delusions. Several types of delusions among the delusions, the grandiose and the perceived delusions, very much important. Other delusions there, and in the delusion of concerning thought, the thought instant thought processing thought is important. Other is important in ground of the neurotic disorders or the mood disorders, not the schizophrenia and schizophrenic disorders. And again, some sorts of the medical symptoms, that is the physical symptoms, is the pain, numbness might be present, and even then the physical disorders might be present in the exaggerated way in the psychological basis. That might be very much important. And this is comorbid illness. And the biological symptoms, very much important. This is regard this might be regarded as in some sort of the that is the endogenous problems, not the reactive one. That is reactive one, that is the any sorts of occurrence in the environment that might be ingrained yourself, and you might be present and the way. This is an reactive. And the biological, that means if there is a change in the your internal problem, your brain, that may be reflect in some way. That is the sleep disturbance, loss of appetite and constipation and diarrhea and lack of interest, amenorrhea, and the sexual problems. So very much sorry, today we cannot concise into very much methodically. In the next Sunday, we will concise in an. I will try to concise in an some sorts of the good way. And if any sorts of questions regarding regarding the today's lecture. You can have some questions, please. Hello, can you hear me?
Yes, sir.
Sir.
Any sorts of questions regarding the psychosis, neurosis, regarding the delusions, hallucinations, regarding the psychiatry, psychology, regarding the normal behavior, abnormal behavior? If no questions there, we might conclude these sessions, and I want to focus on the some sorts of your personal measures. You should be stay your home in all sorts of precautions, and we are going through these sorts of the presentations to prevent some sorts of the contamination, some sorts of the that is the to keeping your health proper way, and take care yourself and take care your family, and hopefully afterwards we will meet again, and all sorts of exams might be delayed, but you should be prepared yourself for sitting the exam in only the 1 or 2 months notice. So you should be cautious in your exam and your study, and obviously you should have some precautions yourself to stay safe and healthy. Thank you.